Infertility and bicornuate uterus. A normal uterus has a pear shape and is located in the center of the pelvis. A bicornuate uterus has a downward collapse of the uterine base, forming a saddle-shaped appearance. Incomplete fusion of the uterus results in saddle-shaped tissues at the top. Bicornuate uterus has two horns, not only having an abnormal appearance but also a smaller uterine cavity volume. It can lead to reduced menstrual flow and irregular cycles, repeated early and late miscarriages, infertility, biochemical pregnancies, ectopic pregnancies, and various pregnancy failures. Bicornuate uterus is observed through laparoscopy or laparotomy to examine the external shape of the uterus. Clinically, it is classified into two types. Type 1 has a large uterine septum, and removing the septum by lowering the uterine base restores normalcy. The other type is the bicornuate uterus, incomplete fusion of double-horned uterus, which becomes normal after surgical fusion. Diagnosis relies on panoramic four-dimensional color ultrasound, dynamic digital hysterosalpingography, hysteroscopy, laparoscopy, etc. After confirmation, the treatment is crucial. IVF is not recommended for bicornuate uterus as it involves normal eggs and sperm but an abnormal house for the child. IVF is a waste of money and cannot result in a normal pregnancy. The treatment option is hysteroscopy combined with laparoscopic correction. For the septum type, under laparoscopic guidance, the septum is cut open using a cold knife and pear-shaped stents with biodegradable barriers are placed. After surgery, the uterine endometrium grows normally, the uterine shape becomes normal, and the uterine cavity volume returns to normal. Not only can normal pregnancy be achieved, but miscarriages can also be prevented. At Beijing Antai Hospital, bicornuate uterus is treated under a signed contract with a full refund if the goal is not achieved. IVF should be avoided as it is ineffective for this type of uterine anomaly. The cause lies within the uterus, not the ovaries, and certainly not the male partner's sperm. The uterus is the cradle for child development and growth. With an abnormal uterus, IVF is futile. IVF merely combines eggs and sperm and places them in the uterine cavity. This is a waste of money and will not result in a normal pregnancy outcome.